And then when I woke up a few days later, I thought, like, where's the anxiety in my body? And where'd the depression go? And why do I feel so different, like so quickly after the procedure? So it was phenomenal.
Welcome to Curing with Sound, a podcast presented by the Focus Ultrasound Foundation. I'm your host, Allison Preston Smith. At only 9 years old, Monica Russell was diagnosed with obsessive-compulsive disorder, a debilitating condition that can make the simplest tasks a challenge. For years, she navigated life with the help of medication and therapy, but the COVID pandemic escalated her symptoms to an unbearable level, making her unable to leave home or see friends and family. In 2023, Monica participated in a clinical trial at Sunnybrook Health Sciences exploring focused ultrasound as a potential treatment for OCD symptoms. 2 years later, her compulsions are significantly reduced. She's back to work, maintaining close relationships, and enjoying a happier and healthier life. Welcome to the podcast, Monica.
Thank you so much. I'm very, very happy to be here and interested to talk to you guys about my journey.
Let's start at the beginning. What was it like experiencing compulsions, anxiety, and obsessive thoughts as a child?
I would say, so I was diagnosed at the age of 9 with severe obsessive-compulsive disorder. And I think that it was very confusing and terrifying for both myself and my family, for sure. I don't know exactly when my symptoms started, but they kind of came out sort of initially in fits of what seemed to be rage. Like I would just get incredibly frustrated and then just kind of yell and scream and have these fits because I didn't understand what was going on. So what I would do, some of my sort of compulsions and obsessive thoughts as a child, I mean, I had a small bit of hoarding at the beginning. I would collect things that I didn't need, like boxes and wrapping paper and just a fear of letting things go. So a few initial hoarding tendencies, but most of my OCD is focused on contamination. So feelings of disgust, which lead to a lot of rituals to prevent or try to eliminate any sort of perceived contamination that's going on. I would, at the age of 9 and 10, I would be taking long, burning hot showers to the point where my skin would turn red. My hands were cracked. I remember getting a tan in the summertime, and I washed the whole tan off my hands, and they were bleeding and raw and cracked. I couldn't even bend my hands. So very, very painful, especially as a child, wondering what's going on kind of thing, because I couldn't really understand what the disease was at the time. I just knew that I was having all of these issues.
Did you use medication at first?
Yeah. So, I mean, back then, at the age of 10, I was put on medication and I was dedicated a psychiatrist and a psychologist. Medication and therapy, so sort of traditional cognitive behavioral therapy, and some ERP, which is exposure response prevention, sort of like the lead-in treatments for OCD. So I was starting to explore those at a very young age.
Your symptoms escalated when you experienced more stress, like during law school. What kind of symptoms or compulsions did you experience at that time?
After getting into the system as a child, I had lots of help up until the age that I was 18. Therapists, psychiatrists, psychologists, and medication. And then, like I said, CBT and ERP. So as I got older, I actually initially never thought that I'd be able to do certain things, especially excel the way that I did in school. Once I got into law school, I got in a different city. So I'm from Toronto, but I got into law school in Ottawa. So I moved away from home for the first time and left all of my doctors who were back in Toronto. And the stress and pressure of law school exacerbated my symptoms. Essentially, my daily life became agony. I spent all waking hours worrying about becoming contaminated or trying to refrain from becoming contaminated or trying to deal with anything that I thought was contaminating me at the time. And then on top of that, I would spend several hours a day cleaning things, including my whole body with Lysol spray, and even Clorox spray, which is bleach. So I was trying to eliminate any potential germs that could be on my body that I thought would harm me in some way, me or my family. So it made it very difficult to have to experience all of that while working, around 80 hours a week trying to complete law school. So it was, I think the stress definitely exacerbated the symptoms for sure.
And during the COVID pandemic, your symptoms grew worse. Was it a rapid escalation, or did the compulsions slowly start creeping in?
So while I was away in law school, I did try a few therapists and found a psychiatrist at the school who would work on changing my medication. I also tried hypnotherapy, but at the time, unfortunately, it wasn't didn't produce results for me. Really, it was medication and therapy at the time. Immediately following law school, I actually attended a residential program at Rogers Memorial Hospital in Wisconsin and spent 4 months at the facility doing intensive exposure response prevention therapy. That helped significantly, but there was no equivalent program to when I moved back to Canada. So adjusting from being sort of under the 24-hour surveillance and supervision and working on exposure response prevention for 8 hours or more a day, it was difficult to leave that program and transition back into normal life because there was no sort of step down or tiered program because I was in the States and I was coming back to Canada. Now, fortunately, in Toronto, there is a residential facility for OCD, and I've also attended that program too. During the COVID pandemic, my symptoms grew worse. This is a bit of a tough question. With OCD, it's kind of like every time you give in, no matter how seemingly small it is, it does give OCD more power. So I would say during COVID, it was initially a slower onset, but a bunch of things sort of built up. And within no time, it was a rapid escalation up to severe symptoms. So I went from working full-time downtown Toronto to being stuck in the house because we were on some very, very rigid lockdowns. COVID itself for me too was very tough because of the theme of my OCD, as I fear contamination. And everyone was so strict about using hand sanitizer and Lysoling things and not getting too close to people. And I translated that into whatever contamination fears I had with OCD. So it kind of really, really exacerbated my symptoms. Then there was being locked down in the home for several months where I had no real opportunity to work on challenging myself with ERP and CBT. So my symptoms really did grow quite rapidly over a couple of year period, and life became absolutely 100% unmanageable.
When did you first hear about focus ultrasound as a potential treatment for this?
So I had heard about focused ultrasound probably sometime in 2022. And initially I was admittedly very nervous when I first heard about it. Throughout COVID, I did try to find alternative treatments, and I did undergo about 50 rounds of transcranial magnetic stimulation. And I also underwent a ketamine regime to try and reduce the crippling depression that came along with the obsessive-compulsive disorder. Unfortunately, neither of those treatments had very long-lasting effects. They sort of helped while I was doing the treatment, and then you have to maintain it, but there's significant cost associated with these things too in Canada. So it became unmanageable. So after trying TMS, transcranial magnetic stimulation, and ketamine and not getting the results I had hoped for, I spoke to my psychiatrist about the MRI guided focused ultrasound. In December 2022, I had an interview with the neurosurgeon team at Sunnybrook Hospital and was screened in as being an eligible candidate for the FUS procedure, which was great. And by March 2023, I was scheduled for surgery.
Can you walk us through the days leading up to treatment? What did they have you do before the treatment?
The few days leading up to it, I was nervous for sure, but I remember the day of being incredibly excited. I couldn't wait to get in there. It had been for me 27 or 28 years that I had been absolutely crippled by my illness. I tried every other form of treatment, and knew that this FUS MRI guided focused ultrasound surgery was kind of my last resort. Even the list of potential side effects that my doctors went over with me felt incredibly manageable, as opposed to continuing to live with debilitating OCD for the rest of my life. And the side effects were nothing scary. It was, you could experience headaches, some nausea. There's no record of anybody ever having any other complications sort of psychologically from the procedure. So I wasn't too worried about that, but I did know that I could not try. So again, I had exhausted all other forms of treatment and knew this was something I had to do in my life if I wanted a chance at trying to potentially reduce my symptoms and having some form of a more normal, manageable life.
So walk us through the actual treatment itself. What did that look like and what did that entail?
So what you do is you go into an MRI machine, but they connect the focused ultrasound machine to your head through the MRI machine. So they had to screw the plate into my head, and that would prevent me from moving while the procedure was underway. It was a local anesthetic, and that was used, but 4 pins were screwed through my skin and a little bit into my skull just to keep the plate secure. This did not hurt very much. There was a local anesthetic, and that kicked in quite quickly. So that was sort of the first step. Then they gave me some medication throughout the procedure. I'm not sure what they used, but it's called conscious sedation, so that your brain isn't fully asleep, so that the MRI machine can monitor your brain in real time while they're doing the surgery. The procedure itself took approximately 5 to 6 hours, and I was in an MRI machine for that entire time. I did fall asleep for most of it. They did some test rounds at the beginning to heat the machine up, because what they do is watch your brain, and then you've got ultrasound waves coming in from all different directions, and they converge on your brain at a specific spot to create a lesion. So for most of it, I was asleep or very out of it, which was great, because being in an MRI machine is a little anxiety inducing, but they make you as comfortable as possible. When the ultrasound machine heated up and actually made the lesions in my brain, I did feel some slight pain and sensation, but which lasted a very short period of time. So it was maybe a few minutes of being uncomfortable while those lesions were being created, sort of thing. But right after that period, once the machine was cooling down, I remember falling back asleep in the machine. So it was also just an overnight stay at the hospital afterwards. The pain that I experienced post-surgery was actually mostly just from the plate having been screwed into my head and then needing to be removed. No stitches were required or anything. I've got a few cool little tiny scar marks that remind me, and I'm, people think they're freckles or dimple pieces. And I'm like, oh no, actually, by the way, I have a much more interesting story about those scars. But my brain did feel a bit foggy in the morning, and I had a little bit of a headache post-operation, but nothing that was unmanageable. And once I visited my doctors in the morning, I was allowed to go home the next morning. So once I got home, I remember being very, very tired. I did experience some swelling in and around my eyes and upper face. And it took about a week for that to sort of go down. But after that, I didn't feel anything.
Did you notice your symptoms changing, or did you notice a difference in the compulsions? Did that slowly decrease?
So it's interesting. I actually ended up getting 2 treatments. The first procedure, unfortunately, didn't really stick the way that we had all hoped. So they decided to retreat and did the second treatment, which was very successful. So what had happened was, after the first one and after the second one, my depression was eliminated almost immediately.
Wow, that's incredible.
It was incredible. It was absolutely incredible and almost sort of unbelievable, right? Like how it can just turn off because the way that I felt anxiety in my body changed very quickly after the procedure. I used to be, walking around with my shoulders up and my back strained and my neck strained constantly and feeling anxiety very, very much in my chest and upper stomach. And that feeling completely went away. So I did not feel the anxiety. I did still have obsessive compulsive disorder symptoms. But gradually, with time post-op, I noticed a significant reduction in the amount of symptoms. So I would say that today, a couple years out, it's been a year and a half since my second treatment, and my OCD symptoms are down probably 35 to 40%.
That's amazing.
It is amazing. It's incredible. The OCD was still there when I finished the procedure. And your brain takes a little bit of time to reroute itself and figure out, how to work around the lesions that were made. But everything became easier and more manageable and far less daunting. And without having the depression and without having the anxiety, I was able to manage more and focus a bit more on my OCD and work a little bit more at tackling that using sort of, regular CBT and exposure response prevention and things like that. So, I'm still noticing a year and a half out after the second treatment that my symptoms are continuing to go down. I'm back at work. I'm doing things and going places that I never would have thought possible before the surgery. And even my family notices even a larger difference in me than I do for myself. So they can see, and they just say, like, we haven't seen you happy like this ever, right? So it's absolutely something that I do not for a second regret doing.
What are you most proud of that is well outside your comfort zone of where you were before that you've been able to do?
Being able to go places and see people that perhaps I wasn't able to before. And now I'm getting that part of my life back where I can reconnect with friends and I can get out of my house and I can go out and experience the world. That's probably the biggest change for me.
And what does management look like now? Like, do you still take medications and do you still do different therapies to still, treat the OCD in addition to focus ultrasound?
Yes, absolutely. So the medication that I was on pre-surgery did not change. And I've been working on exposure response prevention. I'll come home and I'll wash my clothes like I do all the time, like everybody would, right? But it's not, avoiding places completely or going somewhere and then having to throw out everything I was wearing because it's quote unquote uncleanable or anything like that. So I've really been able to reconnect with myself as an individual and with very important people in my life. And that's just been absolutely life-changing.
Yeah, that's amazing. What would you say to others who are considering this treatment and who may not have heard about focus ultrasound before?
There are so many factors that one needs to consider, but if you've tried other forms of treatment and they've failed, I would say absolutely, without a doubt, go for it. It changed my life entirely. I'm back at work. Like I said, I'm excelling in my personal life and I'm doing things in places that I never imagined myself doing prior to surgery. So it really gave me a second chance at life. It's overwhelming, but you have to realize that OCD is absolutely overwhelming also. So you have to kind of weigh those two things against each other. Maybe make a list of pros and cons, what living with OCD is like, pros and cons, and then what getting the surgery would be like, pros and cons, and weigh those against each other and do what is best for you, of course. But I do not regret it for a second. And I do not regret having to be retreated. Even if I had to go back in time and remake the decision, 1,000-fold over, I would make the same decision and choose the surgery.
Is there anything you'd like to say to the researchers who helped with your treatment?
None of this would have been possible without them, and they saved my life. They did. They really did, and I owe them more than I can ever give. So just the fact that there are people out there who are working on these things and trying to make people's lives better is incredible. And I'm so fortunate to be able to live somewhere where I have access to this. But truly, truly, they saved my life. So I am forever and indefinitely grateful to all of them.
Well, thank you so much, Monica. This was a significant milestone that we even had this clinical trial, and you've done so much for other patients by participating and sharing your story.
Oh, thank you. I appreciate that. It's my pleasure and privilege to be able to share my story. Thank you so much.
This episode of Curing with Sound has been presented by the Focus Ultrasound Foundation. If you'd like to learn more about Focus Ultrasound or the foundation, visit our website at fussfoundation.org. You can also sign up for our newsletter and follow us on social media. Be sure to subscribe to the Curing with Sound podcast so you don't miss the latest information about Focus Ultrasound. You can also rate and review the show.